studio with my guest, Dr. Anas. And in that report that we just saw, we saw a form of the Da Vinci surgical procedure. And to be quite frank, I wasn't expecting to see this kind of social setting during the procedure. So Dr. Anas, could you tell us what was going on in that report?
So if you're concerned about the social setting, as I explained earlier, the Da Vinci system separates the patient from the surgeon. I mean,
sure.
Each are at different areas. And you're working, the surgeon is working in an area that's non-sterile, or let's say that's not 100% clean. So therefore he can let people in, that's fine. Because the patient is at the safe area where the instruments are 100% clean and they're sterile and everything would be fine. However, sometimes in some surgeries, I mean, it depends on the surgeon. If the surgeon sees there is a possibility to let someone of the family in, he might make it happen, but it's always a risk. I mean, sometimes you're afraid because he's not familiar with the setting, you're afraid that he might contaminate your equipment, and therefore you might have an infection or a complication during your surgery.
Right. My only concern was the actual distraction. I wasn't afraid that some of the equipment was going to be infected or anything like that. Or again, do you think this depends on the surgeon himself?
Yeah, again, I mean, some surgeons, if you go into the OR and watch the surgeons working, they work in sometimes in a very friendly environment. They keep concentrating, and at the same time they make life easy and simple. However, some other surgeons, they prefer to be 100% like focused, and they don't need any distraction. They are easily distracted. So again, it's on the person himself. Some surgeons, they can concentrate and keep the surgery going 100% right, and still they can keep chatting. Others no. They don't prefer this.
Dr. Anas, during the report we had a side discussion where we talked about that sometimes surgeries can be performed where a doctor is in one country and the patient is in another country. What kind of surgery is this?
This is called a telesurgery or a remote surgery. Mainly it uses high-speed connections between one country and the other in order to perform surgeries abroad, overseas. So if I'm here, for example, and I need to operate on someone in France because I'm the only one who knows about this case, or I'm the best candidate for this, so I can do this while I'm in Saudi Arabia and the patient is in France. And we can do this through the Da Vinci system that would be equipped with high-speed connections. And therefore you're physically here, but you're doing the surgery overseas.
Do you think there are more risks involved with this sort of surgery?
I think it has a specific setting. It's not as easy as we're explaining now. There's too much precaution about it, and there would be probably a team.
Standby team.
Standby team in the country where we're doing the surgery. However, it is, I mean, so far it's safe. Yeah, it would be fine. But as I told you, there is some precautions, of course, because this is abroad and you don't know what happens during this procedure.
Are there any high-tech surgeries that we still haven't discussed so far?
Well, the field is open. I mean, in medicine, you have a lot of things developing and a lot of new technologies. Mainly other than laproscopy, for now in surgery and Da Vinci, I haven't heard of. But, I mean, if we go into other fields, you would find hundreds and hundreds of new things coming up.
Sure. I think there was one terminology that I heard not so long ago called minimal invasive surgery. So could you tell us about this a little bit more? Well,
it's an alternative term for laproscopy,
okay,
but it's the broader term.
Sure.
So minimal invasive surgery, it means, as I discussed earlier, just the idea or the fact behind laproscopy is that you're using small openings or incision into the body rather than opening a very large one. This is called minimal invasive. You're invading the body but with less space or with less areas, and therefore it's called minimal invasive surgery.
Wonderful, Dr. Anas. It's about time that we go out and we take another look at another report that the team has prepared. It's about a laparoscopic gastric bypass surgery, so stay with us for that.
Ready, set, go. back so fast from this, it was amazing. With our other labs, they had the big long incisions, and we had to wait 14 days. If you can imagine trying to calm something like this down for 14 days, it doesn't work.
This is the blood vessels that we're going to actually cauterize. It's laparoscopic surgery, and we have this ability to make a very, very small surgical incision, and we have the ability to be able to view everything internally with a very tiny camera.
I have a lot better visualization during my surgery, so I can see the whole time everything much better than in a traditional spay. I can make sure, you know, I'm not missing anything. I can make sure nothing's bleeding.
Our goal with anything is to make sure that they're never in pain, and having a laparoscopic procedure really reduces it dramatically. So this is what actually makes all the laparoscopic procedures possible. We're using it mostly for spays, gastropexies.
And this is for large breed dogs that are predisposed to bloating. This is a preventative procedure that we do where we basically tack the stomach to the body wall to prevent the stomach from turning on itself. And the other thing that we can use it for is biopsies, especially like liver biopsies, pancreatic biopsies, things like that, much less invasive and quicker.
There is your belly button, and there, and there is where they did the surgery. And you can see that it's almost, they're almost the same size. If I ever got another female dog and had to have them spayed, I'd choose the laparoscopic every time. Yes, less pain for you, and makes me feel better.
And we're back on Up to Date, and with me here in the studio is my guest, Dr. Anas, and of course in that report we saw a view of a laparoscopic gastric bypass surgery, and I guess you had a look at that surgery and there was a lot of vets performing surgery, so what's going on there?
Well, in gastric bypass surgery, what we do is that we take the stomach out, and we bypass the stomach and connect the esophagus into the intestines right away. And why we do this procedure is that because some patients, they have excessive obesity, and sometimes the last treatment for obesity might be surgery. And we do this in order to decrease their food intake, because when you have a smaller stomach, your appetite for food would be less. And therefore we decrease their weight eventually. But we don't do this unless this is the last option available. We try other options such as dieting, healthy lifestyles, but the surgery would be the last option we do.
When laparoscopic surgery first was invented, was it performed on animals before humans? Was it tested?
Yeah, definitely. Everything before we do on humans, we start on animals, and this is how research is built up. Mainly we start only by by theory, by linking stuff or by building onto stuff that is present before, and then we start working on mice. And then after mice, we start, because they're very, biologically identical to humans. And then we start working on other animals, trying these surgeries and watching the complications, sometimes on chimpanzees or other animals, which are also identical to humans, or they have very good similarities. And then we do it on humans. We start, doing the research on humans, and then it's approved. We can start working on everyone.
Well, obviously, since it's performed on animals first, there's an attempt to try and reduce the risks involved with doing any kind of surgery, let alone laparoscopic surgery. So do you think that there are some complications associated with this form of surgeries, and what are some of those complications that have occurred?
You mean when we perform on animals?
Now, when we perform on humans, sometimes complications do happen when you're using this sort of technology. So what kind of complications are most common?
Well, when we do surgeries on human beings, the most common complications we have is infections, because you're at a hospital, and because you're doing a surgery, you have an open wound, and therefore you're more likely to develop any infection. Also hemorrhage during bleeding, during the sometimes the surgery or after the surgery. You might bleed, or someone might bleed. Also, you have other risk might be, as I told you earlier, is the injuring any adjacent organs or vessels or nerves. Also, and I mean, this is the broad idea about complications. However, if we go into, for example, spine surgeries, they have a specific type of complications that is not present. I mean, that is more likely with them other than other surgeries. But this is the most common complications, usually.
Dr. Anas, I want to thank you very much for being with us on Up to Date and joining us and sharing your views and shedding light into some very difficult terminologies for me personally and for a lot of the viewers. Do you have any final words that you might like to say?
Yeah, definitely. I would like to thank you first and thank the Saudi 2 channel for hosting this great program. Also, I would like to thank my seniors, Dr. Hani Khalifa, who's my senior now currently at Kingdom Hospital, and I would like to thank the family, everyone here. That's a great environment. Thank you very much. I enjoyed the show. Thank you.
And it's about time right now that we go to our final report. It's about colonoscopy procedures. So stay with us, dear viewers, for that report.
Minimally invasive procedures that I perform cover a broad range, from removal of the gallbladder, removal of gallstones from the bile duct, removal of cancers of the stomach or small benign tumours of the stomach, resection of colon cancers or segments of the colon for diverticulitis, or segments of the intestine for inflammatory bowel disease. And we now know that it's safer to do it through the laparoscopic approach than through the open incision. Patients can breathe and cough normally after the surgery far more early than they can with a large incision, and they're able to mobilise and get out of bed and get back to their normal activities far more quickly.
And we're back on Up to Date, and with me right now is my second guest of the evening, Mr. Wiam Dakishli, who's a training sales supervisor. I would like to welcome you to Up to Date first of all.
Thank you. Appreciate it.
Being a trainer in sales, could you tell us some of the most updated sales techniques that companies are using today to sell their products or services?
Okay. Now, as in training in sales, currently there are new methodologies in sales. Usually companies are adapting in order to increase their sales.
Sure.
Now, the most important function of any business or any company is the sales, because this is what drives or keeps the company moving. The sales have been transformed through time, from being traditional people knocking on doors, showing brochures, then continuing in order to coming to consultative selling. People start to be like more a consultant for the companies, being trusted advisor. And the latest methodology in sales is around knowing the behavior and knowing the, let's say, the psychology of the other people in front of you. So understanding what do the other person think about and how he thinks, in order to communicate better and try to understand his needs.
Right, well, obviously understanding consumer behavior is a first step to understanding how consumers behave in order to try and offer them services or products that might satisfy their needs. But how does a company find out what the behaviors or the trends are?
This have been done through experience and researches all around the world. Now, psychologists like they put theories, and people start to take these theories into practice. And after practice, this is what shows if this theory is correct or not.
Right. Well, there's a lot of confusion amongst people between marketing and sales. Sometimes people think that marketing is sales and sales are somewhat different. So could you tell us, is it the same thing or are there differences between the two fields, I guess?
I thank you very much for this question, because usually people confuse between these two things.
Sure.
Now, marketing is a tool that complements sales. Usually companies use marketing in order to generate more leads, spread awareness of their product, their company. However, marketing alone cannot perform sales. And sales alone cannot perform marketing, so they complement each other. There are two things that complement each other.
Wonderful. And I think people in sales have more pressure because they have to actually drive in the revenues.
Yeah, exactly. Exactly, because as I mentioned earlier, sales is the main point for each company, which keeps them moving. So if sales is not there, so there will be no finance, no HR, nothing about the company. So
Sure.
This is the main function.
Well, Mr. Wiam, you mentioned that there are a lot of techniques being used in sales. What would you say is the most successful technique in sales?
The most successful one is questioning. Why? Because people buy because of a need. And in order for us to understand this need, we need to ask questions, probe inside, and understand exactly what does the customer want.
Sure.
So this is mainly questioning, which lead us to the direct need of a customer.
All right. What other sales techniques in your training do you also talk about?
We talk about connecting to the customer.
Okay.
Connecting to the customer is very important because usually people buy emotionally. They only take a decision consciously, but they buy emotionally.
Okay.
Let's take, for example, you went to a market and you saw a new car. What do you feel? The first thing you see the car.
It depends what color.
So it's mostly your emotions.
Sure.
So that's why how to connect emotionally. And another thing is the barrier usually, now people perceive the sales as someone who's coming to take their money.
Sure.
So the first thing they do is they raise a psychological barrier. So
You mean the consumers raise the barriers?
Yeah.
Okay.
For instance, if you are trying to sell someone a big deal, let's say, first of all, you enter to his office, the first move he will do, he will just lean back. This will show you that he built a psychological barrier between you and him to protect himself.
Okay.
So connecting to him and try to remove this barrier is very important part of the sales goal.
Wonderful. Well, you mentioned that a lot of people buy emotionally. Why is their buying habit emotional and not practical?
This is relates to the psychology of the human being.
Okay.
Usually people like to have everything they see new. So take it as an example, anyone who goes and see a new, let's say, new mobile phone in the market, he will have a feeling inside, wow, this is nice, I need to buy it. So the first thing, they become emotional. When he starts thinking really about buying it, he will start considering price, budget, features, benefits, all this stuff. But the first decision taken was emotionally, and this is related to human nature.
Right. Well, you said that sometimes consumers raise barriers between them and the person who's trying to sell them something. Do you think that sometimes salespeople tend to push too much a certain product or a service?
I thank you also for this question, because the new methodology in training and sales training is pulling and not pushing.
Okay.
As you can see, if I try to come and push you towards buying something, you will start to be suspicious about me and think that this person is trying to take my money. However, if I understood exactly what are your needs, what you're looking for, what's exactly that you need, in this way I will be your trusted advisor.
Wonderful.
And it will be much more easier to sell.
Right. Do you think that there are sometimes other mistakes that salespeople tend to make? Are there common mistakes between different salespeople?
Well, it's usually related, let's divide it into two parts.
Okay.
Selling mistakes or behaviors mistakes.
Okay.
In selling mistakes, what they do, like the pushing, as we talked earlier, and in behaviors, usually salespeople know what they have to do, but they don't do it.
Why is that?
It connects also to their childhood. Everyone in his childhood, his parents raised him and directed him towards the right path. And sometimes you might hear your mother saying or telling you, don't talk to strangers. This might be the first thing that comes into the back of any salesperson's mind. Okay. When you are trying to call someone, the first thing comes to back of your mind is don't talk to strangers.
Okay.
So this might stop you from doing what you have to do.
So again, it's all about psychology. It goes back to the salesperson. They might have their own set of barriers to start with.
Exactly.
All right. Some people have pressure talking to new people. So I guess sales would not be a right fit for them.
Yeah, true. Now, no one is born thinking that I'm going to be a salesman when I grow up.
Okay.
However, it's a profession you take from loving of being around people, showing them new things, similar of what you're doing here, showing new technology and new updates. It's loving of showing the other people new things and things they love to see.
Well, if you had to describe the ultimate salesperson, let's say, what are the skills or the attributes that this person would need to have to become a really good salesperson?
Well, most of all, let me give you in a simple manner.
Okay.
It's the income statement which states who's the best salesperson.
Okay.
In the other hand, salesperson needs to have charisma,
sure,
needs to have understanding of other people, needs to know what to say and when to say it, and this is very important for the sales.
Do you think that having the right sets of negotiation skills and being very persuasive are also very important?
Exactly. Exactly. Negotiation, let's divide the sales call.
Okay.
So negotiation comes at the end part. So if you need to take a typical sales call, we will start with opening and building relationship with the customer. And the other phase is understanding his needs and what he's looking for. The other one is seeing does what we have satisfy his needs and trying to match our product to his needs. And the other one will be solving any concern that he's having about the product. The last part will be negotiation. And when you reach the negotiation, it's almost a done deal. Because usually you won't reach this place if the customer is not convinced with your product.
Wonderful. Well, Mr. Wiam Dakishli, I want to thank you for being with us and joining us on Up to Date and sharing your thoughts on sales and on marketing as well. Do you think, or do you have any final words that you would like to say?
Yes, I would like to thank you for this opportunity, and I would like to say to all the people that training is very important for your lives and for your career progression, so you would be more advanced in your life. And thank you, and thank Channel 2 for this initiative.
Well, this brings us to the end of the show tonight on Up to Date. And of course, today we had a number of very interesting topics. We had a meeting with Dr. Anas, and he talked about the different forms of very recent and developed surgical procedures. And of course, we talked to Mr. Wiam, and he talked to us about sales techniques and what are some of the best ways that a person can sell a certain service or a product. I hope the show tonight has been very helpful and very beneficial and added to our own sets of information.